Chapter 4. Beginning medical care once pregnancy is confirmed. The next essential step is initiating proper medical care. Prenatal care is the foundation for a healthy pregnancy, ensuring the well-being of both the young woman and her developing baby. For Maya, her first visit to a healthcare provider marked a turning point, moving from uncertainty and fear to a proactive, informed approach to her health. Prenatal care begins with a thorough medical assessment. At her appointment, Maya met with an obstetrician who asked detailed questions about her menstrual history, overall health, medications, family medical history, and lifestyle habits. This assessment helps identify potential risk factors, such as pre-existing conditions like diabetes, high blood pressure, or anemia, which could affect the pregnancy. Early detection allows doctors to monitor and manage complications effectively, reducing risks to both mother and child. A physical examination is a key component of the first prenatal visit. Maya's doctor measured her blood pressure, weight, and overall physical health. Laboratory tests were ordered, including blood tests to check hormone levels, blood type, and anemia screening, as well as urine tests to detect infections or other concerns. In some cases, early ultrasounds may be recommended to confirm the gestational age of the embryo and monitor early development. These tests may feel intimidating, but they are critical tools in ensuring the pregnancy progresses safely. One of the most important aspects of early medical care is the introduction of prenatal vitamins, especially folic acid. Folic acid is vital in the first weeks of pregnancy to prevent neural tube defects in the developing baby. Iron, calcium, and vitamin D are also often recommended to support both the mother's health and the baby's growth. Maya learned that taking these supplements consistently, in addition to eating a balanced diet, significantly improves outcomes for mother and child. Nutrition plays a central role in prenatal care. Maya's doctor advised her to consume a variety of nutrient-rich foods, including fruits, vegetables, whole grains, lean proteins, and dairy products. Adequate hydration is equally important, as it supports increased blood volume and overall physiological changes during pregnancy. Certain foods, such as unpasteurized dairy, raw, or undercooked meat and high-mercury fish, should be avoided to reduce the risk of infection or developmental complications. Maya realized that her diet was not just about her own health, it directly influenced the well-being of her baby. Lifestyle adjustments complement medical care. Maya was encouraged to maintain moderate physical activity, such as walking or prenatal yoga, to improve circulation, reduce stress, and support overall health. Sleep and rest were emphasized, as fatigue is common early pregnancy and can impact both physical and mental well-being. Importantly, she was advised to completely avoid alcohol, tobacco, recreational drugs, and certain medications. Even small amounts of these substances can harm fetal development, so abstaining is essential. These lifestyle changes, though sometimes challenging, form the backbone of a healthy pregnancy. Another critical component of early prenatal care is education about warning signs. Maya was taught to recognize symptoms that require immediate medical attention, such as severe abdominal pain, heavy bleeding, persistent vomiting, dizziness, or fever. Understanding these signs empowers young women to act quickly, potentially preventing serious complications. Clinics often provide printed or digital resources outlining these warning signs, helping girls like Maya stay informed and vigilant. Maya also began learning about the stages of pregnancy and what to expect in the coming months. First trimester changes often include nausea, breast tenderness, mood fluctuations, and fatigue. Understanding these common symptoms reduces anxiety, as girls recognize that many changes are normal and temporary. Her doctor explained that early education helps young women anticipate challenges and take proactive steps to manage them, rather than feeling overwhelmed or frightened. Importantly, medical care extends beyond physical health. It supports emotional well-being. Maya's doctor asked about her feelings, stress levels, and support network, reinforcing the idea that mental health is an integral part of prenatal care. Healthcare providers often encourage girls to seek counseling, join support groups, or speak openly with trusted family members about emotional concerns. By addressing emotional health alongside physical health, young women are better equipped to navigate the complexities of pregnancy. Medical appointments also offer a platform to discuss reproductive choices, planning, and long-term goals. Maya learned that continuing education, career planning, and life goals can coexist with pregnancy, with adjustments and support. Doctors can provide referrals to resources such as educational programs, social services, and financial aid if needed. These discussions empower young women to approach pregnancy responsibly while maintaining their personal development. Confidentiality is a key aspect of medical care, especially for adolescents. In many healthcare systems, minors have rights to confidential services regarding reproductive health. Maya was reassured that her conversations with her doctor were private, encouraging her to be honest and open about her symptoms, concerns, and lifestyle habits. This transparency enables healthcare providers to deliver the most accurate, effective guidance. Early prenatal care also includes planning follow-up appointments. These visits are scheduled regularly, increasing in frequency as pregnancy progresses. They allow doctors to monitor the baby's growth, detect any emerging complications, adjust nutritional or medical recommendations, and answer questions as they arise. Maya marked her calendar with these appointments, understanding that consistent care is a key predictor of healthy outcomes. Finally, Maya began taking an active role in her own health education. She read materials provided by her clinic, watched educational videos about prenatal care, and asked questions during appointments. Being informed reduced her anxiety and strengthened her confidence in making choices that affect both her life and her baby. This knowledge, combined with medical guidance and emotional support, forms the foundation of a successful and responsible pregnancy journey. In conclusion, beginning medical care after pregnancy confirmation is a pivotal stage in ensuring health and safety. For young women like Maya, this involves comprehensive assessment, laboratory tests, nutritional guidance, lifestyle adjustments, emotional support, and education about warning signs and future planning. By actively participating in medical care and taking responsibility for their well-being, young women set the stage for a healthy pregnancy, informed decision-making, and positive long-term outcomes. Early medical engagement transforms uncertainty and fear into knowledge, preparedness, and empowerment, a critical foundation for the months ahead. Key educational takeaways from Chapter 4 to 1. Schedule the first prenatal visit promptly after confirming pregnancy. 2. Expect a thorough assessment, including medical history, physical exam, and laboratory tests. 3. Prenatal vitamins, especially folic acid, are essential for early fetal development. 4. Maintain a balanced diet, adequate hydration, and avoid harmful substances. 5. Moderate exercise, rest, and stress management support physical and emotional well-being. 6. Learn to recognize warning signs that require immediate medical attention. 7. Understand the stages of pregnancy and common early symptoms. 8. Confidentiality and open communication with healthcare providers are crucial. 9. Plan and attend regular follow-up appointments to monitor health and progress. 10. Active participation in learning about pregnancy empowers informed decision-making.